Hey folks, this is Mario Schlosser, CEO, co-founder of Oscar Insurance. Thanks for joining us today here. And George, how are you doing?
Good. Hello, everyone. This is George Kalogeropoulos, CEO of HealthSherpa. It's a pleasure to be on the show.
Thanks for coming on, George. It's great to see you again. We've known each other for how long? 15 years, I think.
Sounds more. What? No. Yeah, right about there.
Well, right. And so I'm glad we both are helping people get covered in today's day and age. So thanks for coming on the program. Thanks for talking to me here. I'd love to hear you out on your thoughts on financial challenges people face, many of us face during COVID-19, and how we can think about the role health insurance in getting insurance coverage plays during this time. And maybe say a bit more about what HealthSherpa, your company, does before we jump into that.
Sure. So at a high level, we build enrollment technology to help people enroll in marketplace coverage, like the plans that Oscar offers, and in Medicaid as well. And what we're seeing now, more than ever, is that that's a hugely important thing that lots of people need right now, because as unfortunately tens of millions of people have been losing their jobs, there's been a huge surge in demand for enrollment in affordable comprehensive health insurance coverage. And as we'll discuss, it's not always the easiest thing to get signed up. And so it's a real interesting opportunity, but also a real important sort of responsibility that we have right now.
Yeah. No, and you and I actually happened to work together at the same employer in the last recession, 2008, 2009. And in those days, the ACA, the Affordable Care Act, wasn't around. And so if you lost your job back then, you really had very few options as to how to retain your health insurance. And I, for one, am very glad that we at Oscar, you at HealthSherpa, other insurance companies can now help to provide insurance coverage for folks who unfortunately lose their job in this, and who at least are able to retain insurance coverage. So thanks for doing that and driving that. As a segue there, why is health insurance coverage important? What additional perspective have you earned there throughout this pandemic now?
Health insurance coverage is access to, it's fundamentally what it is it's access to healthcare. There is a lot of choice in this country, and what that means is that there are also a lot of nuances that one has to be aware of. And so I think health insurance coverage is fundamentally important because it's people's access to healthcare. And of course, high quality health insurance coverage, and high quality means covers everything, doesn't limit what payouts, doesn't exclude pre-existing conditions, covers your prescriptions, covers your hospitalizations, and so on and so forth. High quality health insurance coverage, like the coverage that Oscar offers and that HealthSherpa shows people who visit our site, is hugely important now. It's important because time and time again, access to healthcare is one of the key determinants, I think, of healthcare outcomes. And you see that in the data and research studies show that repeatedly. And so there's a lot of work that has been done and a lot of work that needs to be done in terms of bridging the access gap and making it easy for people, one, to sign up for the health insurance, and then, to your point, to actually use that health insurance and to use that in a way that maximizes sort of the health of the member and minimizes sort of the negative outcomes that can occur.
What the state of Oregon did a few years ago is it wanted to expand Medicaid coverage, so lower income health insurance coverage paid for by the government, paid for by the states. And it didn't quite have the budget to give Medicaid to everybody who was eligible for it in the state in that particular year. And so they basically said, I'm going to phase this in over time. And I'll do this by essentially running a lottery where, depending on your social security number, if you are eligible for Medicaid, you could either get in this year or the next year or the year thereafter, and then kind of stay in the program from there on out. And that gave them a chance to compare side by side the impact on people's lives of getting insurance coverage for those who are getting in the first year, the second year, and the third year. And what they basically found was that you had a tremendous impact, in particular, on mental health. I think something like 35% more people felt much safer in their lives about not worrying about going bankrupt if they had a big medical bill or they fell ill. You had a 50% increase year over year in office visits to the physician, much more cholesterol monitoring, more mammograms, in other words, more preventative healthcare.
This is the burden, the responsibility that we bear, that we discussed earlier, right? Which is we have become, both of our companies, over, just to your point, over the last 5 to 7 years, critical components of the way in which the people, the infrastructure through which people access healthcare. And so it is incumbent on us to, be good stewards of that, and to carry out our responsibilities in terms of helping the people that we serve. And also, anything that we can do in terms of getting the word out is unbelievably important, because the reality is, by the time someone comes to a Health Sherpa, or by the time they come to an Oscar, they're going to be okay. We will take care of them. We'll take care of them. The real challenge is what happens before that, and all the steps that get them there. Because, particularly to our earlier discussion, when you've got people who have always had employer coverage, whose employer has been paying thousands of dollars a month for their health insurance, and people are completely oblivious to this fact, and suddenly they lose that, and they're presented with a COBRA bill for thousands of dollars a month, or misleading or deceptive advertising on the internet. It can be a really fraught and challenging path to a good outcome. And so that's why it's so important that people take the time to understand their options, and to screen for the best, to screen for their eligibility for the programs that are designed by law to help.
So, picking up on this topic of real people voting with their feet and demanding a better solution, I actually think one other reason why in the marketplace plans you've got more tailor-made solution to the needs of the real kind of consumer here is because the way many plans get sold is very much through friends and family, meaning the brokers. But unlike, again, in the big employer, so to speak, where you don't really know who's in your HR department and things like that, many folks in, let's say, Florida, Texas, and so on, buy from a broker, right? Who likely is a person they know, they otherwise maybe might be friends with in their lives, and so on. So it always seems to me this creates a kind of social pressure that broker wants to sell you something great, something that he or she can stand behind as well. And so at Oscar, actually, I love nothing more than when open enrollment starts, or before it starts, really to go around the country and meet brokers, meet general agents, and really get their feedback and talk to them about the issues their members have and how we can solve them, help solve them. I love that part of it. And you service the brokers in a big way at HealthSherpa as well, right? What are you expecting there now in open enrollments? Depending on whether we can go on the streets again or kind of go and meet in person again, how is the broker's life going to change?
That's a great question. So brokers, to your point, brokers are a critical resource for their communities in terms of helping people understand what to sign up for, actually sign up for it, get the coverage, use the coverage. And so traditionally they've performed that function face-to-face, in person, oftentimes over the proverbial kitchen table. That is is going to be less feasible and less recommended, I think, by health professionals as we approach open enrollment this year. And so everyone, just like the entire economy has had to adapt, so brokers have started to adjust the ways in which they reach out to people, the ways in which they keep in touch with their customers. Fortunately, brokers historically have done a great job of using the telephone to get a hold of their customers, to get a hold of prospects, to help people enroll. And I think going forward, even more of what they do will migrate to a phone-based interaction. Now, it doesn't necessarily mean that people will suddenly start doing this stuff online, simply because it's a very complex process, and oftentimes a broker can be an invaluable resource in that. But I think you're going to get even more phone-based enrollment, potentially facilitated with online tools, with online quoting tools like HealthSherpa, with online, member portals like Oscars. But the underlying nature of the relationship, the fundamental value of having an advocate who is on your side, who understands this complex landscape and is working on your behalf to help you navigate it, that won't change. It will just, the format in which that consultation occurs may shift slightly more to the phone.
Your best-in-class brokers, the ones you see selling the most and having the best reviews from the members that they sell to, what are they doing differently?
So the best brokers have built a business and built and reworked their entire sort of business model and approach to the industry with the advent of the ACA. So the best brokers took the changes that the ACA made and took the things that the ACA made possible and made them an integral part of their business. So one thing that we emphasize a lot when we work with brokers who may not be familiar with the Affordable Care Act is that because lower income folks are so heavily subsidized by the federal government, and the federal government actually covers as much of their premium as they need covered to get them to to get them to maintain their coverage. The value of a low income consumer is just as high to a broker on the health policy as the value of a higher income consumer, because the difference is being made up by the government. And so, in a sense, there's an opportunity here. And the best brokers that we see in this space have realized that because of federal subsidies, you can now afford to treat lower income people just as well as you treated your higher income clients. Spend the time with them, help them understand the coverage, help them fill out the application, help them make sure their prescriptions and providers are covered. And then when they actually have the coverage, help them actually use that coverage. Because on the back end, everyone has to make a living. You will earn as much serving them as you will serving someone who's paying the entire premium out of their pocket. And so the best brokers understood that fundamental dynamic, that federal subsidies made it possible for for-profit brokers to focus their energies on lower income subsidized folks, and have built businesses around helping those people and providing them with the level of care and service that historically was only lavished sort of on higher income populations.
Yeah. Yep. It's a great point. It's great points. And the other thing perhaps is that the world is virtualizing even more, right? I mean, you and I are doing this over Zoom. It's great to see you, George, even via Zoom. What have you seen there in terms of best practices? Like, who are the brokers who are the best sort of Instagram and TikTok and Facebook pages game that you've seen?
It's a great question. So we've seen very creative approaches both on Facebook and on Instagram and all over sort of social media. Because fundamentally, I mean, we suffer from our industry suffers, I think, a little bit from an image problem and also from a boringness problem. At the end of the day, the way that healthcare bills are sliced and diced and processed is not the sexiest thing imaginable. And so we've seen some very innovative approaches by various brokers to sort of get over that boringness hurdle and make what we do, because it's important. It's so important. Everyone gets that it's important. But making it less painful, less boring, more engaging. And so, it's not, honestly, the most effective brokers aren't necessarily the ones with the most polished production, but the ones who are most, it's an extension of their personalities.
Right.
Where they're telling, storytellers, they're very engaging people to work with. They truly care about their customers and want to help them, and are willing to go the extra mile and spend the extra 10, 15, 30 minutes to make sure people really understand their coverage. And so I would encourage, all brokers to really push the envelope in terms of getting the word out and marketing themselves. And don't be shy, because what's effective isn't, there isn't really, you don't have to be polished. You don't have to be perfect. You don't have to have a video production staff. As long as you're authentic and you understand what you're doing and you know how to help people, that will resonate.
I couldn't agree more. I think my pet peeve about healthcare really is, and probably not just mine, that it's a fifth of all of our income. People don't necessarily know this, but that's really what it is. It's a fifth of the country's economy is healthcare at this point. That means it's a fifth of your income as well. So it's unbelievably important in terms of the money you spend, the money you earn, and so on. And obviously, if you really get good healthcare coverage, you can live longer. I mean, if you get your preventive care, you can discover issues earlier, you can sleep better and things like that. And yet we have an entire industry that has generally been removed from the end consumer, right? Big insurance companies that sell to employers, hospital administration that is on the front lines and things like that. That's what I love about the individual market. That's it's very different the way we talked about there. And what I love about the brokers, that they are out there, in the in the restaurants, in the streets, and so on, really selling plans, explaining that to people who they know and who they're friends with. And I think that's a genuine connection. And you're exactly right. The best brokers have a genuine desire to help in a way that's just very powerful and inspiring for me to see as well when I'm interacting with folks there. I would also say you're exactly right. On the social media side, on the digital sides, look around. Or brokers should look around how many tools there are nowadays out there, right? Go to Wix or go to Squarespace, build yourself a website in 5 minutes, super easy. Plenty of simple tools to do some very simple gamification, simple competitions you can run through your Instagram accounts and things like that, right? If you're working with 3 or 4 other folks as brokers and you run a little competition there, give them some points for signing people up in open enrollments. That's very easy put together. You fire up an online Google spreadsheets. You count a little bit what they're signing up for. You pay you pay a reward, a steak dinner or something that is a reward for signing people up, and boom, you've got a nice gamified enrollment system there, right? That's all possible and doable nowadays, and people should really look around and see what the opportunities are there.
I couldn't agree more. And I would say that when you look at what makes a good broker, they're a good salesperson, certainly. They're also a good marketer, and they're also critically a good advocate. So if you can market, you can sell, and you can advocate for your customers, those are the ingredients. That's all you need to be a good broker, that and a license and a certification.
That's the framework. That's the checklist right there. Exactly right. Let me ask you this actually. What tips do you give a broker as to what they should be doing towards their insurance carriers?
So that's so the honest answer there, Mario, is what we always tell brokers is so remember who you work for. A broker actually works for and represents the consumer, the individual enrollee, and so that's a burden and a responsibility, right? It's not just a commission check. It's also the responsibility for being that person's advocate with the health insurance company and being their guide as they navigate the actual utilization of their healthcare coverage. And that is a tremendous responsibility. But guess what? When you do it well, you will get lots of referral business and you will get lots of additional customers because people will know that they can trust you and will build that personal relationship with you and come to rely on you. And there is nothing, in our industry, nothing more gratifying than meaningfully helping someone actually use their health coverage and access healthcare and take better care of themselves. Because to Mario's earlier point, maybe you're helping them sleep better. Maybe you're helping them catch something that would be very serious. Maybe you're actually, contributing to the process that saves their life by helping them understand how to access their prescription coverage, how to go see doctors, which hospitals they can go to, how to book appointments. All of these are part of what being a good broker is and what good brokers do. And so I would encourage brokers not to shy away from that, because the reality is you can spend a lot of money on marketing and then have a transactional relationship with the people that you enroll, or you can view the time that you spend helping your customers as marketing in and of itself. Because guess what? To my earlier point, when you help people, they will appreciate it and they will tell others who need help to come talk to you. And so oftentimes the cheapest marketing is actually good customer service.
I couldn't agree more. It's a give and give between the broker and the insurance company, I think. And we try to take this very seriously at Oscar. For example, one to-do brokers often have is to find a physician for their member in the insurance company's network. And that's something I think we make much easier for our brokers because we've built so many tools to help members directly find physicians. And I think do a very good job at really making sure we match you with the right physician at the right price and things like that. And so there, I think as a broker, I would look for ways in which the insurance company makes my life easier because, as you said, nothing is better than recommending an insurance company to a member and then getting referrals from that member for other members you as a broker can sign up because the folks you sold insurance plans who actually love the insurance plan, which I think in our case, we strive to be the case with everything we do. And in the other direction, this works as well, where we give our brokers some insight into who among the members that they have signed up are using the mobile app, are using the free telemedicine that we have and things like that. And the brokers can go back to the member and say, hey, did you know that Oscar has these and these benefits which you haven't used? and now you should go and use them. I think that's critical feedback for flowing in the other direction from us to the broker back to the member. That's also very important for brokers to really utilize and take seriously. So yeah, it's a give and give, not a give and take in all directions there.
And it shouldn't be a transactional relationship. It should be an ongoing consultative relationship.
Exactly that. That's extremely important. This is why I originally came into the world of health insurance. Unlike in many other financial service relationships, you use your health insurance several times a year. You are going to use healthcare. The average member has 3 or 4 doctor visits, has several prescription drugs in any given year. So there are reasons why you're going to interact, and you got to make every one of these interactions the best they can be and be satisfying for the member. George, hey, it was great to see you again.
Same here, Mario.
Yeah, I'm glad you're well, and I'm glad your family's healthy, and I'm looking forward to actually open enrollment again this fall and explain to people why health insurance is important and why they should go to HealthSherpa to buy it.
Well, thank you very much, Mario, and we look forward to that as well.
Awesome. See you soon, man. Thanks a lot.